You're listening to Start Me Up with Roisin Ni Chleirigh.
You're listening to the Start Me Up Business Programme with Roisin Ni Chleirigh. You can email us on info@communityradiokilkennycity.ie. You're very welcome back to the Start Me Up Business Programme here on Community Radio Kilkenny City 88.7 FM, your only local community radio here in the heart of Kilkenny. And just before the break, we were speaking to Martin Pendeville, Head of Finance in the County Council here in Kilkenny, and he was talking us through the government's Restart Covid-19 grant. And now we're moving forward from the grants to the back to work protocols in reopening businesses after closing in Covid-19. Today marks a significant step in the roadmap to reopening the country and the county here in Kilkenny and locally here in the city, as people are opening their doors for business again, and business owners are taking all the guidelines, all the procedures from the government, opening up the businesses and reopening and restarting and rebooting your business. And now, during each phase of the Covid-19 pandemic is stressful for many business owners and organisations during the end of the phase 4 in August. We're walking through a new normal to opening up your businesses and open up your businesses to the general public. However, there are government guidelines available to the roadmap in reopening your business. And a little earlier on, I was talking to Orlagh Deegan, who is a health and safety expert, and this is what she had to say. And on the line to discuss this issue is Orlagh Deegan, qualified occupational health and safety advisor. Orlagh works with food safety and health and safety training and consultants, and licensed food safety trainer with Food Safety Professional Association, National Hygiene Partnership, Environmental Health Association of Ireland. And Orlagh works with all industries and has been extremely busy over the last month assisting businesses in reopening safely. Orlagh Deegan, Choice Training and Consultancy, welcome to Start Me Up Business Programme.
Thanks very much for having me on again. I'm always glad to talk to you, Roisin.
Orlagh, you're very welcome. Orlagh, I suppose, like yourself, I have been inundated with local businesses here in Kilkenny. I know we have the government.ie website for the health and safety and back to work procedures and policies and guidelines, but yes, people are still very confused, and some businesses are very reluctant to open, and because they're so unsure what to do. So have you had that same response?
We have. We know some businesses are well prepared and they are opening and they're getting back to business and have been over the last few weeks, but there are businesses out there that are struggling. They're not sure if they can open, if they can't open, what do they need to put in place before they open. And there's a little bit of uncertainty. We're nearly at a stage now where there's too much information, there's too much guidance, and it's actually confusing people. But we always break it down. We risk assess each individual business and look at, is it safe for them to open, and what procedures do they need to push in place, and of course based on the up-to-date government HSE and HSA guidance as well.
And Orlagh, what is your main concerns that you're hearing from people?
I think they're worried about employees coming back and how to properly implement social distancing. Because there's a fear, obviously, among some employees that, okay, well, if I go back to work, am I at risk? And there might be a little bit of reluctance to come back. And while the majority of staff actually want to get back to work, they've had enough time off, they're excited to get back to work, there is a genuine fear there among some people. So it's trying for the employer to ensure that the workplace is as safe as reasonably practical when those staff come back. Now, obviously, because it's a virus, because we can't see it, we don't know where it is, we don't know who has it, it's very difficult to know if someone has been in store or present. So all of the measures that we take are preventative measures to lessen the risk. We can never eliminate the risk, but we're always trying to make the risk much lower than if we did nothing. And I think most employers are taking this on board, and they're doing really well.
Orlagh, you mentioned risk assessment. Can you just talk us through about what a risk assessment is? Because many startups might not be, so they might be aware and they might not be aware. What is a risk assessment and how do you do it?
Perfect. So we work with risk assessment in health and safety and in food safety and have done so for many years. So with any risk assessment, the first thing is we look at what are the potential hazards. And obviously in this case, we're talking about Covid-19. So Covid-19 is the hazard. And we look at how does that transmit from person to person, what are the ways that it spreads, and then we categorise that into, is it a high-risk situation or a low-risk situation? For example, if you're within 2 metres of another person, especially if they're a suspected case of COVID, that would be extremely high risk. So what we need to do is implement control measures for any of the risks and hazards. So we implement control measures in order to lessen the risk. So for example, if we had a suspected case of COVID among our staff and we were waiting to get them taken home from site, we would need to make sure that we had on full PPE while we're, I suppose, tending to them and talking to them, so we are lessening the risk of catching the virus from them if they were to actually have it. So that's what risk assessment is all about. It's assessing what kind of level the risk is at. Is it high risk, low risk, medium risk? If it's high risk, we're trying to bring it down to medium risk or low risk. So we're always trying to lessen the risk. And as I said already, we can't always eliminate risk, but we can certainly lessen risk and make the environment safer for our employees and for our customers as well.
And tell us, what policy and procedures should business owners put in place before opening or during the process of each phase?
Okay, yeah, very good question. I suppose the first, because there's so much information out there, it's like, where do we start? So I think a really good place to start is decide who's going to be your COVID officer or your COVID manager or your lead worker representative. Now, there's lots of different terminology there. Some industries, such as the construction industry, use the term COVID compliance officer, whereas I've seen a lot in the food industry, they use the term COVID champion. And now, since the return to work protocol document was issued by the government, they use a term called lead worker representative, where an employee in the business is selected as a lead worker representative, and their role then is to help the owner or the manager to implement the procedures. So once those people are selected, they should receive training for their specific role and how they are to implement things. And some of the key things are, we need to look at everything we do, look at the footfall on a premises and look at the touch points. So we need to implement specific procedures that relate to our business. For example, if you had a small shop that was quite narrow, it might need to have a one-way system, or you might need to extend the aisles or only allow 2 people in store at a time to allow for social distancing. So the lead worker representative and the COVID compliance officer will sit down and work this out. Now, when I say sit down, they'll probably sit down over Zoom or one of these online platforms rather than sit down around the table like we normally would. And they'll put the procedures in place. They will look at things like social distancing. They will look at the cleaning routine. So our cleaning routines that we already have in place are probably very good, but we need to step them up. It's not okay just to clean the workplace at the end of the day like we normally would. We will have to clean all the contact touch points throughout the day. So if you think of an office environment, think of things like the keyboard, the mouse. Do people share a stapler or use the same printer? If they're in the canteen, do they use the same kettle? So any of these points where people touch regularly will need to be sanitised after being touched. And then, of course, at the entrances, we will need to have hand sanitizer for public coming in, for staff coming in. So there's lots of things. None of these things are difficult, but there's a lot of things to consider. And in a retail outlet, for example, if you're going to have a counter where somebody comes to pay, we'll have to look at having the Perspex screen or barrier to protect both the employee and the customer.
Yeah, and so therefore there's a lot of training that needs to go into this before, and training your staff before opening.
Yeah, so the return to work protocol document actually states that whoever is selected to take those lead roles must receive training. And then it states further in the document that all staff require training specifically on COVID and infection control before they return to work. Now, some of that training is done in-house. Sometimes what I'm finding a kind of a trend is people are sending people to me maybe, or companies like me, for the COVID compliance and the lead officer training, but then those people are going back and they're reiterating this and training their own staff in-house if they're feel competent to do so. Or there are companies that are saying, okay, Orla, will you actually do our induction training for staff returning? And they're sending me their procedures, or many of them I've helped them with their procedures, and we do specific training for their staff on their return to work induction and infection control. So I suppose it's giving people the knowledge to empower them to know what to do and to feel safe going back to work, and they know what measures have been taken in line with the government recommendations.
And, we're talking about training and compliance and people going through the a one-way system through a shop. So signage is going to be very important.
Absolutely. Normally we say in health and safety that signage is one of the weakest forms of control. But I think actually from what I've witnessed myself, when it comes to COVID, signage actually works quite well. And I've noticed it myself when I go to the local supermarket. Initially when they opened, well, they never closed. Initially when they were putting in their measures, they had the queuing system outside, and they had, for example, the signage, the lines on the ground showing 2 metres. And everyone was very obedient. They stood on the line, they waited till the next person moved on, they moved up the line. But what was happening is, as soon as they went in the door of the supermarket, there was no lines, there was no markings. There was a sign to sanitise your hands, of course, and there was gloves available, but there was no markings throughout the supermarket, and people were on top of each other, probably not realising it. But I think kind of towards the end of March, the supermarket actually put lines on the aisles, and especially around the vegetable area, and you can see the difference in how people behave and how people react. They actually are much more compliant. They stand on the line, they wait for the person in front of them to select their products and put them in their trolley and move on, and then they move on. So signage definitely has a role to play, and we need to have signage there to remind people, sanitise your hands, wash your hands, maintain social distancing. So I would definitely recommend signage to encourage people and remind them. And you'll notice in supermarkets and kind of bigger shops, I know a lot of the retailers are opening again today, they will have over their PA systems reminders of, what they expect of people. And, I know the one in our local supermarket is, please, come prepared, don't spend ages browsing, come on your own if possible, and, get your shopping done, ensure, maintain social distancing, sanitise your hands on the way in. So it's all these constant reminders, because as time moves on, as things reopen, people start to become a little bit more complacent, and they kind of forget what's expected of them. So we have to constantly remind them, and signage is a good way to do that.
And although we've covered signage, what is the current PPE advice with masks and face covering? Because an awful lot of people, you're damned if you're doing, damned if you don't, especially people who may have asthma or certain health issues where they're not advised to wear masks. So if you could talk us through the advice for the face covering.
Yeah, so the advice has changed in the last few weeks. So initially, back in March and early April, the advice was you should only wear a mask if you have symptoms yourself, or if you're caring for somebody, maybe in the home that has symptoms. But that advice has now changed. So they're still advising the proper medical PPE in those scenarios. But what the government have now said is they recommend face covering. So they don't use the word mask, they use the word face covering, which means it doesn't have to be medical grade PPE. It could be, I see a lot of people are making homemade masks. In fact, Martine in our office here, she's excellent dressmaking skills, and she has been making masks for local charities. And those masks are absolutely fine, but they're called face covering rather than masks. They can be washed and they can be laundered. And I suppose the key thing with them, the government have advised that if you're using public transport, the guidance is you should wear a mask. If you're in a busy shopping centre or retail outlet, the advice is when you're around lots of people to wear a mask. But it's not the law, so it's not a definite rule. So it's left up to individuals. If they feel comfortable not wearing a mask, that's fine. We would prefer if they did wear a mask, but there's no legislation there. And I think a lot of people, there are a lot of people still wearing masks. But the most important thing is if you're going to wear a mask, wear it right. I've seen quite a lot of people in the supermarket maybe with the mask over their mouth but not over their nose, or maybe they get too hot in the mask and they pull it down onto their chin, so they're not really wearing it at all. So it needs to be worn and fitted correctly. And the idea of the mask is if I wear a mask, I'm preventing spread of my droplets, because even through talking, even if you're whispering, you're spreading droplets. So if I wear a mask, I control my droplets and minimise the spread. And if you wear a mask, you minimise your spread. So you're actually not wearing the mask to protect you from other people. You're wearing it to minimise the spread of your own droplets. So the more people wearing masks, or I should say face covering, the more people wearing face covering, the less spread of droplets and the less risk of infection. But they don't give total protection. But if they do minimise the spread of droplets, and if they make people feel more comfortable, by all means, definitely wear a face covering.
And, you've been talking about communication. Every business should have a communication plan, shouldn't they? Regarding
absolutely. It's so important. So I suppose you need to communicate first and foremost with your staff, especially if they're returning to work after temporary layoff. They need to understand what's happening. I know I've heard from some staff, I haven't heard from my employer since the week of Paddy's Day when we were all laid off and we don't know what's happening. So employers need to engage with the staff, even if they're not sure themselves when they're reopening or they don't have a specific date, and they might not be able to take all staff back, and that might be why they're not engaging. But rather than leave the staff in limbo, even contact them and say, look, we're working towards opening, but we don't have a definite date. And I suppose they need to take HR advice then if obviously redundancies need to be made, and unfortunately that will be a reality. But keeping them in the loop, and then when the staff that are returning, when they're returning, make sure you communicate what your in-house procedures are and what you expect of the staff. So you need to provide them with training on infection control, what you expect of them, a basic overview of COVID. And so this will help empower them to be more comfortable coming to work as well, and they know what's expected of them. And the key thing is we call people COVID compliance officers, we call people lead worker representatives, but it's everybody's job to play their part to keep each other safe. So it's not just down to the employer. So that's the communications with employees. I think we also need to communicate to our customers. They need to know what's happening. They need to know when you're reopening, or you might be reopening limited services, what you can and can't do, and communicating to that customer as well that yes, we have had training, yes, we do have a procedure in place, this is how we're going to look after you when you come in. And every business is different. Some businesses, even I was speaking to some clothing boutiques, and they're going to be by appointment only because it's kind of more of a one-to-one service than going into a big department store. So everyone's changing to suit their needs, and there's still lots of questions unanswered that people aren't sure what to communicate, like things like does the virus live on clothes? Can we use the fishing rooms? And these are things that are still a little bit up in the air, and time will tell. But yes, the virus can live on fabric, and I think the general advice at the moment would be maybe not to have fishing rooms open for the moment.
Yes, and you were talking about health and safety there, about your staff and everything. What if you have a suspected case of someone either working in your environment or somebody that comes in and you might think, oh God, that's a suspected case? how do you protect the person and the other people that are on your team as well? Because you don't want to discriminate or put stigma there, because you want to protect the person who may have a suspected case as well.
Absolutely. So the return to work protocols document, it actually states in it that we must have a procedure in place for dealing with a suspected case, and then a procedure if we find out that that's a confirmed case. So rather than kind of stigmatising someone or victimising them, when everyone's trained coming back, they will know that there's a procedure in place, and they'll know what do we do if. So the general advice, and obviously it'll differ slightly from business to business and depending on their facilities, but obviously isolate that person. You need to get them away from customers and other staff members. And this might be someone who came into work, they're perfectly fine, but maybe their temperature has started to spike during the day and they don't feel well, or they developed a cough, and they mightn't be in a dreadful condition, but if it's symptoms of COVID, we have to be really cautious. So I would bring them in if you have maybe a room, an office, or somewhere where there's not going to be other people, and hopefully it's a room with a window so we can well ventilate it. Make sure if you're the person accompanying them that you have full PPE on, because this is a suspected case. If they have COVID, this is a high risk situation. So we need to have, like we mentioned, on risk assessment, control measures. If they're suspected, full PPE. And our job is to get them home safely and ask them to contact their own doctor or GP, and get advice on whether they should be tested or not. So if they drove to work themselves and they're okay, they're well enough to drive home, absolutely they can drive themselves home. If they came on public transport, you cannot send them home on public transport. And this is where the problem lies, because how do you get them home? You can't bring them home because that puts you at risk. So generally somebody from their household will come and collect them, or if there's nobody to collect them, you can actually call the HSE, or you can call the local guards are fantastic. If you ring them, they might organise someone from civil defence, or they might organise a squad car to come out and actually, drop that person home. It's unlikely they're in a condition where they would need, an ambulance, because, if they were well enough coming in the morning, the symptoms shouldn't develop that quickly. So getting them home safely, and obviously when they've left, there needs to be a very deep clean and disinfection of all the areas that they were in, because if they did have the virus, the spread of it and the control of contaminated areas is very important. Now, if they later are tested and they are confirmed that they do indeed have COVID-19, we need to make sure we have a means of contact tracing among other staff members. So what staff did they work with? What staff did they interact with? And if they were confirmed and they were in close contact with other staff members, then those other staff members will also have to isolate for 2 weeks. And this is where it becomes really, really serious for a business, because they've just reopened, they've got all their staff back, and one staff member gets sick, and they have to ask all the other staff to isolate. So that's a really kind of worst case scenario for a business that has just reopened. So we have to take these measures very seriously.
Well, with all the new phase opening today, I'm sure everything's going to be, it's all new. There's no precedent before with all this. So I suppose everybody is doing all this, taking all these precautions and guidelines and becoming compliant, and listening to health and safety experts like yourself. And really, it's everybody just doing their bit. We're all in this together, as they say.
Absolutely. We are, and there will be businesses who maybe don't comply as well as others, and we might be quick to think, oh, well, they're not doing it, why should I? But I don't fall into that trap. We need to do the right thing for our business, and just because the business down the road isn't doing it, not to kind of go, oh, well, they're getting away with it, so will we, because the HSA and the HSE, there are inspectors visiting all types of business at the moment. So traditionally, if you were to have a HSA inspection, it would probably be a construction site or a high-risk manufacturing site or something like that. But now they are visiting all premises, even if they would be deemed normally a low-risk premises. And everyone's open to inspection. And also the HSE has their environmental health officers out doing inspections for, on food premises, because a lot of food premises are open still for takeaway at the moment. And they've brought in a lot of extra manpower to do these inspections. So I don't think people should be afraid of being inspected. But I think that they should be ready for an inspection and not be too alarmed if a HSA or HSE inspector comes in. They generally tend to stay on site for quite a while, and they will want to observe what's happening in practice. What are the staff doing? How are they managing the customers? But they will also want to see what procedures you have in place. So your procedures can't be in your head. They need to be documented. They need to be written down. You need to be able to show proof of the procedures you've put in place. So we're getting a lot of work from people, I suppose, and assisting a lot of people who are, trying to get their documentation in place and get their procedures in place. And there are some great templates out there on the likes of the hsa.ie website. But a word of caution, absolutely use those templates as a starting point. But your procedures shouldn't be generic. They should be specific to your business. So you need to work with those templates to make them real. And what's really important that you don't just make a document and put it on the shelf and leave it sitting there. It must be a working document. You must be doing what it says in the document and recording what you're doing, because otherwise it's just a document gathering dust and it means absolutely nothing. So this is not a tick-the-box exercise. It's setting procedures and then actually following them. And as I mentioned, it's a working document. So if the government come out in a few weeks' time and they make changes, again, to what's expected, we need to go back to our document and revise it and make sure we're always up to date with the latest government announcements and guidelines.
Well, Orlagh, there's a lot of food for thought and a lot of great advice there that you have for us. And, we really appreciate you taking the time and speaking to us today, because I know that you are awfully busy. And you'll keep us up to date with any different policy and procedures or any different guidelines. And maybe we'll speak to you every week on different issues that could come up.
Absolutely, because things are changing quite rapidly and the phases are changing. And as new guidance comes out, we want to keep people informed and up to date on that.
Well, Orlagh Deegan from Choice Training and Consultancy and Health and Safety Expert. And thank you so much indeed for speaking to us on the Start Me Up business programme on Community Radio Kilkenny City today.
Thank you, Roisin. Always a pleasure to speak to you.
Take care and stay well and stay safe.
Thank you. Talk to you soon. Bye-bye.
Bye.
You're listening to Start Me Up with Roisin Ni Chleirigh. You're listening to Start Me Up with Roisin Ni Chleirigh. You're listening to Start Me Up with Roisin Ni Chleirigh. You're listening to Start Me Up with Roisin Ni Chleirigh.